Wondering if we want to go to get started, just because we've got a lot to get through in a very short time.
Good afternoon, everybody. My name is Patrick O'Riordan. I'm the Interim Director at the Department of Building Inspection. Thank you for joining us for this webinar. We appreciate you all taking the time during this busy time of year. We are holding this presentation because while we know how important construction is to San Francisco's economy, and especially how important it will be to the city's economic recovery, it must be done in a safe and responsible manner. By and large, the building industry has been doing a good job of adhering to the guidelines and rules set out by our public health officials. But as we see cases continue to surge throughout the region, we need you all to redouble those efforts. As always, our goal at DBI is to ensure that builders comply with all the relevant codes. That includes the building code and the health code. Our role in the health code compliance is one of education and outreach. You may have noticed some of our inspectors are providing you with checklists when they observe violations of the health order. This is part of our overall effort to make sure that both builders and the relevant city departments have the information they need to ensure that everyone is complying with the health code. Acting Deputy Director Joe Duffy will speak more to this effort later. Today you will hear from Patrick Fosdal and Jonathan Piakis from the Department of Public Health, who will provide you with an update on the current surge of infections. Jackie McCright from DPH will provide an overview on infections and trends on construction sites. DBI's Acting Deputy Director for Inspection Services, Joe Duffy, who will speak about our process for working with the Department of Public Health. And Peter Keith from the City Attorney's Office Code Enforcement Team, who will speak about some of the potential consequences of non-compliance. And finally, Jennifer Johnson, the city's COVID compliance officer, will wrap things up and manage the Q&A portion of this webinar. I want to stress that we are not looking to punish anyone or shut down jobs. We are here to achieve code compliance, as always. Again, thank you for joining us, and we will begin with Patrick Fosdal.
Yes, thank you, Patrick. Good morning. My name is Patrick Fosdal. I promise you that not all the speakers this afternoon are named Patrick. I'm the Acting Director of the Environmental Health Branch at the Department of Public Health. The Environmental Health Branch serves as the regulatory branch for the department. Throughout the pandemic, the city has used 5 key health indicators to monitor the level of COVID-19 in our community. These 5 indicators are each evaluated daily to determine whether or not we're meeting our public health targets. Each indicator has a color code of green, yellow, orange, and red. Green means we are meeting our goal, while yellow, orange, and red means we're not. Red is where we are considered to be very far off target. The key indicators are listed on the screen there. The first one is hospital system capacity. Here we look at the rate of weekly change to COVID-positive hospitalizations. Currently, we're up 25% based on a 3-day rolling average and in the red. We also look at the 7-day average for the availability of both acute care and ICU beds. We're currently meeting the target for both of those, but the capacity is shrinking weekly. And there's plenty of reason for concern. Regionally, the Bay Area is now well below 15% capacity, with many counties, including Los Angeles, that are at or close to 0% capacity. The next category is the number of cases. Here we evaluate the average new cases per day per 100,000 residents. Our target is 1.8 case per 100,000, and we're currently at 28.3 per 100,000, which is way above the target and color code red. A day ago when the slide was first made, we were at 27.2, so we're not going in a good direction. Daily, it keeps getting larger. The Bay Area has over 60 cases per 100,000. So while San Francisco is better off than our neighbors, this is a regional problem. In the state, we're currently over 70 cases per 100,000, so this is really widespread. The state is averaging over 35,000 new cases per day, has averaged over a 1 week period. And these are record highs. None of it is good news. However, the next category is, and that's the number of tests. In San Francisco, we've done a great job. We are currently testing roughly about 8,000 tests per day. We've done nearly 1 million since the start of the pandemic. The fourth category is the ability to manage contact tracing. Contact tracing has received a lot of publicity, and it is one of the key tools for preventing new infections by determining who has been exposed to COVID-positive cases. However, the more cases there are, the more taxed this system becomes. We're currently only able to reach about 70% of the COVID-positive cases. The last category is the amount of personal protective equipment. This received a ton of publicity back in March when there were well-publicized shortages of things like masks and sanitizer, et cetera. This supply problem has largely been corrected, and we are now meeting the target of having 100% of the needed supplies for a 30-day period. So in summary, our hospital capacity, number of cases per 100,000, and our ability to do contact tracing are key areas of concern right now. I'm now going to turn it over to Jonathan Piakis, who is our resident certified industrial hygienist. Jonathan has been conducting our daily safety tailgate meetings for our branch. I know you all have your own daily safety talks at your job site, so I thought that this would be appropriate. Jonathan will be providing some additional information regarding where we're at as far as disease transmission and what we know about how it's transmitted. Jonathan?
Thanks, Patrick. And good afternoon, everyone. As Patrick said, I'm Jonathan Piakis. I'm a certified industrial hygienist with the Department of Public Health and kind of serving as the health and safety liaison to the environmental health branch since the start of this pandemic. I want to build off what Patrick went over and kind of give everyone a big picture overview of the surge periods that we have and are currently experiencing in the city. On the leftmost graph on the screen, you can see the initial surge in cases in April and May on that graph. You also see the more prominent surge in the summer months. We can compare those two peaks with the current conditions, which is represented by the peak on the far right of the graph. It's pretty obvious that we are in our most significant and serious surge to date. The average seven-day average of new cases per day, which is that number that is displayed on that graph on the left, is directly proportional to that main health indicator mentioned previously by Patrick of cases per day that was at 28.3. We are currently at 246 new cases per day for the 7-day average. Both of those metrics are the highest that we have seen them in San Francisco since the start of the pandemic. Unfortunately, the same is true for other metrics that we look at, including the reproductive rate of the virus and the test positivity percentage, which are both higher than the previous surge in the summer months. One additionally important thing to note on the graph on the left is the effect that protective measures have had on case numbers in the past. After both the first and second surge, we see a significant decrease in cases after restrictions and protective measures have been put in place. This has also had a significant impact on hospital capacity, which can be seen in similar dips in hospitalization numbers in the graph on the right. When hospital capacity decreases and the number of acute care beds or ICU beds are not available, those seeking care are at a much, much higher risk of mortality and other similar poor health outcomes. This is obviously relevant because recently the ICU bed capacity in the Bay Area recently dropped below 15%, which is the state level for the current restrictions in place in the regional stay-at-home order. The available ICU bed capacity in San Francisco is a little bit higher than that of the Bay Area, which is now currently at 13.1%, but the numbers in San Francisco are also trending downwards. If the current trends do not change, we run the risk of running out of non-surge ICU beds mid-next month. At DPH, and especially during this year, we've always tried to end on a positive note. And while the recent progress on vaccinations are unfortunately not going to help with the current surge, it does represent a light at the end of a very long tunnel. But until we can get to that point, it is crucial that we all continue to be very diligent with all of our health and safety protocols, and most importantly, avoid those high-risk scenarios for transmission, both at work and outside of work. Those things associated with higher risk of transmission include close contact within 6 feet of others, large crowds and gatherings, indoor settings with poor ventilation or limited airflow, settings with unmasked individuals or those not using face coverings outside of your household, and overall poor hand hygiene. With that, I'm going to turn it over to Jackie, who will go into some more detail on some related information more specific to the construction industry.
Thank you, Jonathan. My name is Jackie McCride. I'm the Deputy Director of the COVID-19 Community Branch with the San Francisco Department of Public Health. And I'm going to talk to you today, next slide, about the COVID-19 Community Branch Workplace Hub. And our role is to provide updated COVID-19 policy guidance. We educate community stakeholders on informational guidance and disseminate guidance to the community. We foster stakeholder engagement using informational strategies such as webinars and social media, street outreach. We respond to concerns, provide technical assistance for prevention, answer questions at community settings, create linkages with COVID command center partners. And then we also respond in a reactive approach. We engage and conduct COVID-19 exposure notification and guidance with point of contacts and settings such as to employers and businesses throughout San Francisco. We notify every sector such as schools, businesses, churches, community-based organizations, FROs, managers of an exposure in their setting, 7 days a week. And we also identify and implement interventions for clusters and outbreak prevention in the community. Next slide. So I just wanted to share with you some of the reported COVID-19 cases for construction by the week. And I only went back to October 1st, 2020 through December 11th, 2020. And as you can see, starting from the first week of October, it was 24 cases a week. Then it dropped to 11. The end of October, you see it went up to 50. Then it dropped to 19 the first week of November. And then after, start getting slowly higher and higher. And after Thanksgiving, as we mentioned, people probably with families getting together and other behavior, it went up. And so the last week, we saw the highest amount of 65 cases among construction last week. Next slide. So the good thing is that there are prevention tips that you can have. I'm going to give you to maintain the health and safety of your employees. COVID-19 is preventable. Wearing a face covering correctly, covering the nose and mouth whenever you leave home, staying 6 feet apart from others, not living in your household, washing your hands frequently, staying home if you feel sick. If you must carpool, everyone must wear a mask correctly the entire trip. Ventilate the car by letting some windows down the whole time. Next slide. And if you have symptoms or get exposed to someone at a close contact, get tested immediately. Isolate until you receive test results. If you test positive for COVID-19, isolate, stay home. Do not go to the store or anywhere. Encourage employees to stagger their lunch hours and refrain from taking smoking breaks together, eating close together. Must be 6 feet apart if they're sitting outside. Reporting positive COVID-19 cases and close contacts to stop the spread. Sanitizing and disinfecting often for all frequent high-touch surfaces and other items. And we really appreciate you doing a great job reporting the cases and contacts. We're very busy, and we just thank you. So next.
Thank you, Jackie, and thanks, Patrick and Jonathan. We're now going to turn it over to Joe Duffy. He's the acting Deputy Director for Inspection Services here at DBI. Thank you, Joe.
Good afternoon, everyone. Joe Duffy, as Patrick said, Acting Deputy Director here of Inspection Services. I'm just going to speak to you about the DBI role in the COVID health order compliance. We've been asked by from the City Administrator's Office, Health Department, and the City Attorney's Office to get involved in this, and we're more than happy to do so. To reach out to our colleagues in the construction industry today to ask for your help in ensuring that we can reverse these numbers. And I know a lot of the times that we work with you on certain issues, and we're asking you to help us as well on this important issue. Next slide, please. Our role is to ensure the safety of contractors, workers, the public, and our DBI employees. In order to ensure that contractors continue to comply with the health order, DBI inspectors are distributing information about the requirements, documenting non-compliance, and providing information to the Department of Public Health. Next slide. Our inspectors, electrical, plumbing, and building inspectors are checking for compliance with the following requirements: proper mask wearing, construction site screening protocols, social distancing, posting of required signage, providing hand washing stations or facilities for workers, posting of health and safety plan, and other requirements as outlined in the health order. Next slide. If we do observe failure to comply with any of the requirements, DBI will report the issue to the City Attorney's Code Enforcement Team and the Department of Public Health. The inspectors do reserve the right to cancel the scheduled inspections. Thankfully, we haven't had too many of those occasions. But the building inspectors, I think, as you've heard from Patrick, we are filling in a checklist at the site. We are giving you a copy of that checklist. We're also saving a copy for our own records. And again, we're just asking for if you can do everything that you can to meet the requirements of the health order and make us all easier for us to do our jobs. And thank you.
Thank you, Joe. Now we're going to turn it over to Peter Keith from the City Attorney's Code Enforcement Team.
Thanks, Patrick and Joe, and to all the panelists. So in normal times, my team helps support the Department of Building Inspection and other city departments by filing a lawsuit if we have to get code compliance. And in these times, we've really moved to health order enforcement. And frankly, things move so quickly when it comes to the virus and when it comes to the health order that we're not interested in filing lawsuits. We're just interested in keeping people safe. And I think that's a theme that you're going to pick up throughout. So what I'd like to do is go to the first slide that we have here and talk a little bit about some of the resources that you can go to find out your obligations under the health orders, both at the state and the city level. And again, I mean, there's some pretty lengthy URLs here, but if you Google Cal OSHA, it's very easy to find your construction industry guidance and checklists. And again, they call them guidance and they call them guidelines, but they are actually rules. They are mandatory. So these are the standards that the state sets. And there's a helpful checklist that OSHA has regarding each of the obligations that you need to follow under the state. And they're not different from the obligations that the city requires. The city probably has a couple of additional obligations over and above what the state requires, as in most things. But again, you're not going to find conflicts between what the state requires and what the city requires. Your other resource is the San Francisco Department of Public Health website, sfdph.org. You go there, you just type in that URL, you go there, there's a big picture of the coronavirus right on top of the page. Click on that and you'll get to all sorts of helpful information on what's required and what's in each of the industries in the city that's affected, including construction. And I want to point you to some key documents that you'll want to be familiar with. The health order itself. And, the health order is updated ever so often. In fact, I think it was even updated today since I prepared this slide, but it's still the current number is C19-007Q. And that's the health order that really talks about all sectors of industry and life in San Francisco and how they're affected, but very specific to construction, there's an Appendix B1 for smaller projects and an Appendix B2 for larger projects. And those are the parts of the health order that contain the rules specific to construction. So I encourage you to review those. You're probably very familiar with them already. They require you to come up with a health and safety plan for your job site and have it posted and available for the city to review if they come by, and of course to follow those rules. And then there's a couple of other very important documents. One of the issues that Jackie raised was the importance of people screening themselves for symptoms before they come to the job site, and that includes personnel you have working at the job site. That includes people visiting the job site, making deliveries, etc. And there's specific screening forms that the city has that have a list of the questions each person needs to ask him or herself before they go to work each day, and they're the same for construction. Have you been running a fever? Have you had close contact? Have you had these symptoms? And if the answer to any of those questions is a yes, that person needs to stay home, and that's part of the rules. And so you'll find those two screening forms, Appendix A1 for your employees who are on site, for the people who are working regularly on site, and then A2 is for visitors. So you can get copies and print those from the San Francisco Department of Public Health website. So I'm done with this slide for the moment, but before I move to the next slide, I want to talk a little bit about our interest in compliance and I'm going to say enforcement. As Joe said, we're not interested in punishing people for non-enforcement. We're interested in making things safe. And what's going to happen, as Joe said, DBI is regularly reporting to our office and to the Department of Public Health if they see non-compliance at a job site. And what we expect is that sheet that the Department of Building Inspection inspector leaves you with saying, here are the deficiencies I observed, that you take that very seriously and you take that as a list of matters that you need to get in order at your site. Because if we see repeat problems at the site, we're going to escalate the issue. And that escalation can take the form of notices of violation being issued. And, in the ultimate scenario, and this is something that we've had to do in other industry sectors throughout San Francisco, the Department of Public Health can order your site to close. And we can go on to the next slide, and you can see the language in the health order. And again, the prospect of being ordered to close, this is not meant to be punitive. This is meant to ensure the safety of everyone in your job site. And if you look at the highlighted portions of the language, this is directly from the health order, it says the whole point of this is to close down a site until it comes up with a plan to fix the health issues that are happening at that site that satisfies the Department of Public Health, and then they'll be allowed to reopen. Now, again, if the city has to reach this step at any of your job sites, these plans are reviewed very quickly, but they have to be good plans because, again, our interest is in keeping people safe at your job sites. And so, this is one of the consequences that can follow if you don't keep your site safe. And finally, I do want to give a note about employees who have concerns about compliance at their job sites. You can call 311 and make a confidential report of the conditions at your job site, and the city can follow up on that. And of course, and I think this should go without saying, any type of retaliation against an employee, either because you know they made a complaint or because you think they made a complaint, the city is going to view that as an extremely troubling matter and frankly is something that's not being very helpful to public health. And so please, if you're an employee and you see issues at your job site that are not following the health order, that things like what Jackie just discussed, call 311 and report those. And then the other thing is, this personnel screening is so important. If people are feeling symptoms, they need to stay home. As Jackie said, that is one of the top ways that we prevent outbreaks. It's one thing for one person at a job site to get sick. It's another thing for them to come to work and transmit the disease to a half dozen other people. We don't want that happening. So if anybody needs to stay home because they have symptoms, don't retaliate against them. Again, that's something the city is going to view as extremely troubling from a public health perspective. Again, our goal here is to keep everybody healthy, and across other industry sectors and in construction, we've gotten very good response from people. They want to comply, and so we look forward to working with you to make sure everybody stays safe and healthy. So I think with that, my presentation is over, and I'm going to turn it over to Jennifer Johnston, the city's COVID compliance officer, to take questions.
Great. Thank you so much, Peter and Jackie and Patrick and all. Thank you, everybody, for your time today. As I think it's been iterated several times, we are focused on compliance. And to me, as the city's COVID compliance officer, that means education and outreach. Enforcement is a very, very last measure. But and I think we all share the same interest of ensuring ultimately everybody's safety. So, we look forward to partnering with you further in that. A huge thank you to DBI for their efforts in making sure that, each touch includes kind of, review of the health order requirements. Jackie's team, as she said, the workplace does amazing, tremendous work in trying to reach out to all of our, individuals who are infected. I think Patrick said, we're only hitting 70% of that. So the numbers that Jackie shared are, do not reflect the entire scope and weight of the amount of infections that we're experiencing from our construction site. So given the limitation of of this platform, we are not going to be having people speak, but if you want to include your questions in the Q&A section, I'll read them aloud and I'll answer them, or I'll ask Jackie or Patrick or Peter, somebody to ask or respond to them to the best that we can. This is only the first of these town halls. We'll be conducting another one early January. We're also recording this. We'll be posting it on the DBI website for everybody's information. And and again, you can also include your Q&A in the comment section. If we don't get to them today, you can email your questions so everybody's aware. And again, we'll be distributing this again, but it's at dbi.covid19 safety plans at sfgov.org. That's dbi.covid19 safety plans at sfgov.org. Great. Okay. So then I have something from Tim Paulson from the Building Trades. He wanted to make sure that we were aware. Building Trades Council is on the line, and and they are constantly engaged with the city. And indeed, they have been really true partners in this. So a thank you to the Building Trades. And they say all our unions have safety folks, and we will continue to show that we are safe for necessary work. And we agree, absolutely. And Tim, Mr. Paulson also wanted us to know that they are proactive and keep people off the job if they are sick or positive. Thank you for that, and I thank Tim and the Building Trades again. And again, if people are sick, please allow them to take the time off, and and please do not retaliate against people. And really, it's transparency and working together. I know the state of California also has a new app, so I encourage you to use that for contact tracing purposes. I think that'll facilitate the workplace hub's efforts to contact trace. Very critical to our efforts. So, and we'll be engaging in further conversation on that as well. Okay, Roberto Bernard asked if the slide deck will be sent to all. Yes, we can actually absolutely send out, sorry, one other people are sending me texts. Please include your questions in the Q&A. Yes, we will be emailing this out to the distribution list who received the original invitation, and we will be certain to, again, make sure that this is widely available to everybody. Let's see. I'm sorry, Tim Paulson, Secretary Treasurer, of course. Thank you, Tim. My apologies. Let's see. Okay, so Maria Martin asked if employees are allowed to self-screen before coming to work. Can an employer ask to see their daily temperature results as well? I'm going to defer to Jackie or Peter to respond to this question. Again, the question is, if employees are allowed to self-screen before coming to work, can an employer ask to see their daily temperature results?
Jackie, I know that you've touched on that, so or you've dealt with that, so I'm going to let you take the first crack at that.
So, yes. I think that it's important that if you have self-screening, that everyone has to do self-screening, and that the questions are across the board the same for everyone. And you can see that. I think the problem that we've ran into is that if it's on their phone, they can just keep it from the day before and not, show for today. So just make sure that there's some way that it shows that you're seeing the screening results for today and not, last week that they just keep showing you. Does that help?
Okay.
Yeah, I think everything that Jackie said is correct. I would add that the screening has to be done. The employee has to do it, and the employer has a right to require the employee to do it. Whether the employer has a right to see official documentation of that is really a matter to work out between the employer and the union, or the employer and the employee. That is not something that the health order speaks to one way or another.
Mm-hmm. Thank you, Jackie and Peter. Another question. Can I enforce my employees to get tested, and can I ask to see their official results?
I would say that again, the personnel screening form talks about, well, what happens if you answer yes to this question, to a question of, do I have a symptom, or have I had close contact with someone who's COVID positive? And there's two paths that a person can go down. They can either get a COVID test, or they can quarantine for a certain number of days. And so those things are obligatory. Whether, if the employee says that the employer can require the employee to say whether they've tested negative, because that affects when they're able to return back to work. But again, as to whether the employer has access to the employee's medical record stating that is something that's going to have to be worked. The health order does not speak to that. That's going to have to be worked out between the employee and between the employer and the union.
Great, thank you, Peter. Let's see, another. I guess this is common. I'm not sure if there's a question. Let's see. I think just something with respect to the Bayside Village in San Francisco. So I'll follow up with that separately. Okay. Other comments here that I'm not sure are actually questions. I think there's just a general question about large construction versus large construction sites and such. I know that there are two appendix to the health order that we are currently looking at revising, and with a possibility of merging, but certainly to make them more clear. So I think that addresses one comment. Okay. So apart from the obvious, like medical facilities, hold on. Okay. Okay. What can we do to get oversight and protections? Sorry, I'm trying to find questions. Okay, so Rudy Gonzalez has asked, should we expect any revisions to the health order for this industry? We are, like I said, we are in the process right now of updating it based on additional information and advice that we've received on risk of transmission. We are also working on making it a little bit more clear, and also, again, possibly amending them to merge them. So, the distinction between large construction site and small construction site is an impact, but I think we can make it easier to follow, because I know that depending on the site, it could be large or small depending on the job that's required. I think unless anybody has additional questions, which I'm happy to answer. Okay, I think there's additional okay, here we go. Okay, okay, any changes in the submittal process at DBI forthcoming? That's from Michael Carter. I guess Joe Duffy or Patrick, if I can defer to you to respond to those questions about if there's any change in the middle process of GBI. I'm not quite sure what that's regarding, but.
Jennifer, I believe that's to do with more with building permits than the COVID plan, and it's just a matter of contacting our customer service DBI or indeed myself.
Okay. Okay, thank you. And then another question, are there any plans to shut down non-essential construction sites at this point? Not that I'm aware of, no. What happens at the state level, though, I cannot predict or control. I can tell you that, again, we are seeing alarmingly high transmission risks, infection rates at construction sites. And this really is, we're just looking to partner, and it's important that we really do adhere to health order requirements to make sure everybody's safe. And this is, my efforts to education, for education outreach. This is not, we're not threatening, we're not warning. This really is just an effort to, just to really inform you what we're seeing, what the risks are, and begging you for your assistance in making sure that you and your workers are safe and that you're adhering to health order requirements. And again, to the extent that you and others, you can encourage others to sign up for the app for contact tracing. I think that would be helpful too. But everything that we've outlined today really is to educate you and ask, please, for your assistance in, mitigating and preventing the spread of COVID at your sites. And again, a big thank you to the building trades and Tim Paulson and Rudy and Larry and John. We're all working together to do what we can. So with that, again, we'll be having another town hall early January to just, reach out to you and continue this open dialogue. Please do email. It's right here on the screen, the DBI, any questions you have, any assistance you need. I can also provide hand sanitizer to sites. We do have some masks in storage that under the city administrator we acquired long ago, and we can certainly provide resources and support to in any way you need. You just need to ask for it. Let's see. Any other questions? Let me see. Work with my technology here. We're all struggling through that. Okay, so even small construction sites are supposed to have a health and safety plan. That's right. And COVID compliance assigned to those employees. Question: if there isn't a safety officer on site, what can we do to get enforcement? We might, for residents, any concerns you have, you can call 311. They'll be routed to DBI for response. DBI does follow up on any complaints we receive regarding non-COVID health order compliance issues at construction sites. And like I said, Jackie's team does do outreach and education, but when we see, we work very closely with the city attorney, Peter Keith, the city attorney's office, to address, places where we're seeing high infection rates and where we're seeing a great deal of complaints or non-compliance. And we do, take action on each and every one of those cases. And they do get escalated to public health when necessary for, further action. So to those of you, again, if you have any complaints, they can go to 311, they can go to DBI, and we do address and review each and every complaint that we receive regarding noncompliance at construction sites. So I think that answers the anonymous question. I believe, unless Angela or Beverly, oh, here we go. DBI has closed all of our complaints, saying that the contractor management said they have a third party offsite. You know, maybe this individual, it seems like this is more of from a complaint perspective as opposed to education outreach issues. So if you want to go ahead and just email DBI COVID-19 safety plans at sfgov.org, we can kind of take this conversation offline to make sure that we have your concerns addressed. Okay, and that's all I have. It doesn't look like we have any additional questions and answers, but now's the time to ask them if you'd like them addressed for the group. And if not, again, you know, really, please do reach out. We're here. We are looking. We are watching. We are listening, and we are responding. So that's all I wanted to say for the day. Patrick, if you have any closing remarks you'd like to add. But again, my thank you to Public Health, to DBI, to the City Attorney's Office for tremendous efforts in trying to do what we can to keep everybody safe.
Thank you, Jennifer. I'd just like to say thank you to everyone for partnering with us in this very important effort to try to keep everybody safe, from employees to adjacent neighbors to our inspectors. So it's an effort across our industry, and your efforts are really appreciated. Thank you so much.
Great. Thank you all. And if you also want to send me any separate questions in my day job, is the administrator. I'm also a COVID compliance officer. I'm always available for people to contact me directly. One last question. Abby Brown asked, are there any funds available to pay for additional hours for compliance officer monitor for projects on very strict budgets, city-funded projects? We did not address this, Abby, already, but there are resources available. You know, everybody's struggling in every respect. Under the pandemic. So, you know, go to the DBI website. This town hall, like I indicated, is being recorded and will be posted there. So we can address questions. There's information on resources there, and, you know, we'll try and get you whatever resources we can that are available. So I think does every construction site require a safety officer, even if there's only one or two people working at the site? Last question, Peter Keith responds, yes. So again, with that, thank you for your time today. We'll be reaching out again early January for resources. Go to the DBI website, and we do look at we do review all these emails, all the complaints, to try and take a proactive approach, and also outreach and education. So again, thank you for your time, and we will be posting this and other additional resources as they become available. Have a good day, and please stay safe, and Happy New Year to you all. May 2021 bring better fortune for us all. Thank you.
Thank you, guys.
Thank you.